Good day, sir. Good day, everyone. We, the members of Group 1, were tasked with gathering information on the topic hard tissue injuries. We hope that the information we have put together helps you get a better understanding of the subject. The group members are Brianna Pecco, Shikashi Bergen, Shalom Alt, Karishma Baura, myself, Destiny Burnett, Alvin Chetram, Tisani Douglas, James Camp, and Lillian Benons.
What are hard tissue injuries? Hard tissue injuries are those involving damage to the bones of the skeleton. They range from severe fractures and joint dislocations to bruising of the bone. A direct force can bruise a bone and cause bleeding between the outer layer of the bone and the underlying compact bone. This is common in a bone such as the tibia, shin, where there is a little muscle tissue over the bone to absorb the force. Bones have a blood supply, and internal bleeding can result from a fracture. In major injuries, this internal bleeding in the bone, together with bleeding from surrounding damaged tissue, can cause the shock and serious circulatory complications.
A fracture is a break in a bone. This can result from a direct force and indirect force or repetitive smaller impacts, as occurs in stress fracture. If the skin over a fractured bone is intact, the fracture is described as simple or closed. If the skin over a fracture is broken, the fracture is described as open or compound. The skin might be broken either by force of the injury that caused the fracture or by a piece of bone protruding through the skin. A fracture is described as complicated if nearby tissues and or organs are damaged. In some cases, a simple fracture can be difficult to detect. The signs and symptoms of a fracture include pain at the site of the injury, inability to move the injured part, unnatural movement of the injured part, deformity of the injured part, swelling and discoloration, grating of bones. Types of fracture. Closed. The definition of a closed fracture is the bone is fractured, but there is no cut or wound at the fracture site. Associated fracture factors. Bleeding remains concealed beneath the skin, or you're bleeding internally. Open. Definition. A jagged end of the fractured bone protrudes through the skin or there's a cut near the fracture site. Associated factors. Visible external bleeding occurring. Infection may enter the body and the bone through the cut. Infection will significantly delay healing and should be prevented. Complicated. The fractured bone damages the local tissues, that is, the organ or organs that it protects. For example, a lung punctured by a fractured rib, or your heart punctured by a fractured rib. Seek associated factors. Seek medical assistance quickly as damage to other structures may cause internal bleeding.
Dislocations are injuries to the joints where one bone is displaced from another. A dislocation is often accompanied by considerable damage to the surrounding connective tissue. Dislocations occur as a result of the joint being pushed past its normal range of movement. Common sites of the body where dislocations occur are the finger, shoulder, and patella. Signs and symptoms of dislocation include loss of movement at the joint, obvious deformity, swelling and tenderness, and pain at the injured site.
Managing hard tissue injuries, medical treatment. Because hard tissue injuries can be accompanied by significant damage to muscle, blood vessels, surrounding organs, and nerves, immediate medical treatment is required. For serious heart tissue injuries, the person should not be moved and an ambulance should be called. Immediate management in this situation as follows: immobilize and support the injury site with a slight or check for impaired circulation and other possible complications. Arrange for transport to hospital and professional medical assessment. Imply the RICER procedure if it does not cause pain. The RICER method stands for R, rest, I, ice, C, compression, E, evaluation, R, E, referral. Referral.
Immobilization management of heart tissue injuries aims to minimize movement of the injured area. This is achieved by immobilizing the joints above and below the injury site. If the injury site is the shaft of a long bone, for example, the femur or humerus, the injury can be supported with a sling or a splint. A supporting splint should be long enough to extend beyond the nearest joints of the injured site. A splint can either be another limb or another part of the body or a firm, straight object. The correct application of the splint is essential. When correctly applied, a splint is secured at all these 6 points: above the joint, above the fracture; below the joint, below the fracture; at the joint, above the fracture; at the joint below the fracture; just above the fracture; just below the fracture.
In some cases of fracture, a rigid splint is unnecessary. In these cases, a sling or bandaging of the injured limb to the other limb is adequate. With dislocation, immobilization is also the immediate aim. Under no circumstances should the first aider attempt to relocate the dislocation. As a result of the dislocation, there can be associated damage to the bones and to the ligaments of the joint. In most cases, an X-ray is needed before relocation. Any rushed attempt by the first aider to relocate the dislocation might result in further damage to the joint. We hope that our information and way of explaining it to you was clear. Thank you.